I'm very grateful for the opportunity to meet before this committee, and I thank the Chairman, Congressman Kucinich, and the other members for bringing me here to tell you.
Sir, could you please bring that microphone a little bit closer? And before you begin further, I just want everyone in the audience to know that we appreciate you being here, but out of respect for the witnesses in this proceeding, if you have a cell phone, either turn it off or put it on vibrate so that the phones aren't going off in the middle of someone's testimony. You may proceed, Doctor.
Thank you. I did testify before a committee of Congress about 15 years ago on the health effects of power line frequency fields. It may have been the hearing that you mentioned, although at that hearing we were not dealing with radio frequency radiation. As you mentioned in my introduction, I'm a public health physician, not a practicing medical doctor, and it's important to understand that public health is a profession that tries to prevent disease before it occurs, and it's a population-based discipline. So this issue of what do we do when we have some information indicating a hazard, but when that information may not be as definitive as we would like, this is a critical public health issue. And let me just summarize where I'm coming from on this issue, in that I see the evidence that we have at present very strongly suggestive of there being a major risk of brain cancer and other cancers as a result of exposure to radio frequency fields. I certainly find the evidence at present to be less than 100%. But the public health implications under circumstances where the expansion of wireless technology, where every child is using cell phones all of the time, and when exposures are, you can't go into a McDonald's or a Starbucks without being in a wireless environment. And the public health implications, if we don't take actions, and this turns out to be as bad as I suspect it is, these implications are enormous. As was mentioned, I was one of the co-editors of the Bioinitiative Report, a report that appeared about a year ago, written by an international team of 14 scientists who find that the reports from our national bodies, from the FCC, are unduly conservative in our opinion, and in doing so fail to protect the public health. Let me summarize what I see as the most important health effects. Cell phone use really began in Europe. Cell phones were first manufactured in Scandinavia, and in Scandinavia cell phone use was very common about 1980, long before most people in the U.S. even knew what they were. The studies are coming out of Scandinavia showing that if you use a cell phone intensely for 10 years or more, you are at increased risk of developing a brain tumor, an acoustic neuroma, which is a benign growth of the auditory nerve, and in a study from Israel, cancer of the parotid gland, the salivary gland in the cheek. And this increased risk occurs only on the side of the head where the cell phone was used for that period of time. There are many studies of cell phone use that have not demonstrated any adverse effect. Almost without exception, these are studies that were not done for long-term users, and there is a problem with all of these studies in that the exposure assessment, that being, if you were asked how frequently you used a cell phone 10 years ago, you'd have difficulty answering that question. So the research isn't perfect. Now, there are studies from Korea showing increased risks of leukemia if children simply live by an AM radio transmission tower. So that's another form of radio frequency radiation. We feel that the studies from Sweden, especially the study published in 2004 and then a more recent presentation of Dr. Leonard Hardell that occurred at a meeting in London that I attended early in September, showing that if a child or a young adult begins to use a cell phone early in life, their risk of going on to develop brain tumors is much higher than if an adult begins to use it. In the results presented in London 2 weeks ago, Dr. Hardell reported that if a person began to use a cell phone under the age of 20, he had a 5.2-fold elevated risk of developing a brain cancer. In contrast, if one looked at all of the people in his study, the risk was 1.4. So we call on the government to support research with good exposure assessment. We call on the FCC to review their standards for exposure. Their standards are presently based on the assumption, which we feel to be fallacious, that the only adverse health effect of radiofrequency fields is tissue heating. And we call on the health agencies, the NIH, the EPA, the Centers for Disease Control, to issue warnings, especially to children who are more vulnerable to any environmental insult, certainly to radiofrequency radiation. Thank you very much for your attention.
Thank you very much, Dr. Carpenter. Dr. Herbermann, please proceed.